Okay, last recording for this lecture. We're going to talk about instrumental delivery. You might also hear this called assisted vaginal delivery or surgical vaginal delivery. Instrumental delivery is when the infant is delivered vaginally with the assistance of a vacuum extractor or forceps. Forceps were the first major invention for assisting vaginal delivery. Vacuum extractors came along much later. Now more providers use vacuum than forceps. The indications for this, why would this need to be done? The mother's been pushing and is exhausted. Okay. Maternal cardiovascular or cerebrovascular disease. If we don't want that mom to push, if we don't want a Valsalva, which is going to be the case if they have heart disease or if they have some neurologic conditions that we don't want increased pressure, then this might be done to avoid pushing. Heavy epidural, forceps assisted delivery. If they're near delivery and the fetal heart rate tracing is not reassuring, then they might use a forceps or a vacuum to accomplish the delivery more quickly. Sometimes in an abnormal presentation or position, the provider can use one of these assistive devices to get the baby into better position. If the fetus starts to rotate in delivery and then stops, and that has to do with the position thing again, and then in a breech birth, forceps might be used to extract the head. So there are risks to each that are separate, and there are risks that kind of apply to either. So let's look at what we're talking about first. How many, if you've heard of a forceps birth, what did you envision? If you've heard of a vacuum assisted delivery, what did you envision? So let's look at what those things look like. I've got examples of a couple different types of forceps. There are different types, and the different types have to do mostly with the shape of the blades. The blades generally are going to separate, and they're going to be placed one at a time and then locked together to form a handle. So these are going to be placed around the fetal head. Okay. There's actually a video of a forceps delivery, I believe, in the folder that I'd like for you to look at. But these are forceps. Let's go ahead and look at the other pair of forceps. These are slightly different. Different types of forceps are useful in different types of situations. So some forceps might be better for assisting with rotation. Some might be better for assisting with delivery of the head of a breech baby. So that's why there are different types. Okay, now we're going to look at the vacuum. Okay, a vacuum extractor works differently. The forceps are mechanical. Each blade is placed in, the handles are locked together. With a vacuum, a vacuum cup is applied to the baby's head. We can't use a vacuum on other body parts. They can use forceps sometimes on the breech, but we can't use vacuum on other body parts. And then a pump is used to apply suction, and then that's used to help guide the fetus out. So with either forceps or vacuum, the provider is going to place those, and it would be our responsibility to go get the one they wanted, to get whatever else they needed for that placement. And then the provider is going to provide, hopefully, gentle traction with contractions. And the idea is more to help as the mother pushes the baby down, to help with that and to help keep the baby in that position, then pull the baby out. Okay. So the risk with forceps, when the forceps are applied, it's possible to trap maternal tissue, so they can cause vaginal and cervical lacerations. They're more likely to cause perineal trauma because it takes up more space, and we've got these big metal objects that are trying to deliver with the baby's head. They can cause lacerations of the fetal head or face. They can cause damage to the facial nerve, and some of this can be prevented, or at least the risk minimized by someone knowing what they're doing when they're placed, but they're all risk because these are placed by feel, not by sight. They can also cause a subdural hematoma because of pressure on the baby's head. A vacuum extractor is less likely to cause a lot of those traumas, but the baby is always going to have a hematoma on their scalp called a caput succedaneum. They're always going to have that hematoma. Okay. They can also cause more fetal bradycardia because that suction puts more pressure on the head. They can cause cephalhematoma, which is bleeding under the lining of the bones of the skull, and they can cause scalp lacerations. So either has risk and benefits. Most providers are going to use by preference the one that they're most used to using. Okay, I will see you in class.